Great, great. Matt, Sarah, let's switch over to cost. Talk a little bit about cost. How can OneDigital assist us in dealing with significant cost increases that we've all seen in the health insurance market, the health insurance world?
That's a great question, Dean. So, as I mentioned, the climate is very different than it was 5 years ago. And health insurance costs are rising. They're going to continue to rise. In fact, we just looked at some data regarding pharmaceutical drugs. And the data and some studies that we have read have projected a 50% cost increase in the next 5 years for a public sector entity. So we are really seeing these costs going up from COVID, because if you remember, when COVID first came out, the testing was free. The hospital stays were free. And so a lot of these insurance companies are trying to get above the line. And so we're seeing a lot of changes. And something that we do very well at OneDigital, because of our deep bench of resources and knowledge, is not only negotiating and, as I said, using the powers for good with these folks that used to work for the big insurance companies and helping us find that margin, but also doing extensive data reports and looking at what is truly happening in that locality. So is it a certain drug that is costing the rise and the high cost? Do we need to look at a different funding strategy? We dig deep, we get in the weeds, and we get boots on the ground to find a solution. And we're able to really find creative solutions that a lot of other brokerage firms are not aware of.